I am excited to be here with Tom Leary, Senior Vice President of Government Relations at HIMSS. Tom, thank you so much for setting aside the time and welcome to the show.
Thanks, Patty. It's been a lifelong dream of mine. This is you run such a great podcast, so thank you.
Oh, that's very kind of you, Tom. I really appreciate you saying that. Well, Tom, why don't we dive right into this? HIMSS has published a report uh, for which you are one of the co authors, a report recommending $36 billion dollars in public health technology infrastructure modernization. I guess my first question is why now?
Great question. Well, to tell you the truth, Patty, we started our journey in 2018, in the late winter of 2018. We have some staff who said, "Hey, public health is was supposed to be phase two of high tech back in 2010. Here we are heading into 2019, and there's been no real specific investment in public health infrastructure, and we've gotten to a problem where CDC has 159 different systems that all talk to themselves and don't talk across the organization. We've got a real problem that HIMSS needs to be lead on. So we started down that journey by helping to launch a Data Elemental to Health campaign in 2019 as the measles epidemic or measles outbreaks were happening in Washington State and New York and Kentucky and a few other places. And at the launch of that campaign, the CDC director, Dr. Redfield, at the time said, I've got a real problem. I can't respond to this information, to this problem, because I've got 2015 data here in early 2019, so 4-year-old data, and I've got one specific staff member who can help me with this to analyze all of this. So that's really was the launch of the conversation. Well, a full year ahead of the pandemic, but as we move forward in what you look at the data campaign and you look at this report, they're specifically focus on some key areas that this report takes to a whole different level. So what we've learned over the last 2 years and why this report is so important right now is that as we stood up our clinical response in hospitals and clinics across the country, they were able to respond pretty rapidly by adding telehealth and remote patient monitoring and other capabilities, because we had made the investment in the electronic health record and other health IT solutions through the Meaningful Use program. And what was glaringly absent was the fact that the public health community couldn't keep up, didn't have access to the data. Report after report, or anecdotal representation were set up in parking lots. Staff taking down vital information, case reporting, important data, putting it in the electronic health record for the hospital's use or for the clinic's use. But in terms of being able to report it to public health, they had to turn around and get their stubby pencil and pad out and write down the information, and then fax the information into the public health department time after time. It's really what the anecdotal evidence pointed to. Now, some communities were further ahead than others, but by and large, public health IT infrastructure is glaringly 20th century or even late 19th century information gathering, where the clinical setting was well into the 21st century solutions, and the response times, being able to get back with patients on a positive test and what public health could not do to help them was dramatically slowed down by their inability to have a great technology available to them. Technology that is absolutely available in the marketplace right now, but not available to the public health setting. So that's really what prompted us to write the report of, we've made the investment at the clinical side 10 years ago. what is it? What does the public health community need? And that's where we were able to come up with a rather. It took us a little bit longer than we had anticipated, but the results of the 4-month review and multiple interviews across the United States afforded us the opportunity to gather the information to point out this great information that is that's needed, the $36.7 billion that we're recommending.
And we will dive into some of the salient highlights of the report. So I got the broad picture here, highly fragmented infrastructure, the data is all in silos, and our ability for rapid response at the national level or even at the state and local level is seriously hampered by the current state of our infrastructure. So we'll jump into that. But before that, just for the sake of clarity, when you say public health, what are you including in that definition? State, local, federal? What are you including in it?
We're for this report, we're primarily focusing on the state, territorial, local, and tribal requirements. We have, as part of the data campaign initiative, we've been pushing for funding for the CDC to help to modernize their systems, as well as for them to work with their partners at the state and local levels. But this report then takes the conversation one step further and helps to answer the question that we've heard from appropriators and policymakers across the country. What are we really talking about? And, is when we were asking for $1 billion over 10 years, compared to IT systems that have been implemented, whether it's federally at the DoD or VA and their electronic health record modernization, or or some of the efforts that are underway at EHR purchases in health systems across the country, $1 billion was really just scratching the surface. So the question became, what do we really need to be investing at the state, territorial, local, and tribal levels? And that's where this report came from.
So can you help break down the 36 billion for us? So what kind of time frame are you recommending in the report? And how does the 36 billion break down between different components, broadly speaking? Sure. And what are the immediate priorities in your view?
Absolutely. We break it down in the report in two phases, really. The first 5 years addressing key areas that are electronic case reporting, electronic lab reporting, immunization registry, and immunization information sharing, modernization, vital records, and finally workforce development investment of around $25.5 billion. Again, at the state, territorial, local, and tribal levels. And then in order to get them up to speed and really to be equal partners with the traditional clinical side of healthcare delivery here in the U.S., then we turn our attention to the years 6 through 10, establishing a true learning health system within healthcare to include public health, as well as some real other key long-range investments that are more of that results in the remaining $10 billion investment.
Right. These are pretty big numbers, and you've highlighted some pretty glaring gaps or deficiencies in our current public health infrastructure. So the question that comes to my mind is, how does the United States compare with other OECD countries in this regard? Do you have any thoughts on that?
Yeah, and our sense is, it's because the care delivery models are a little bit different from a population and public health perspective. Other countries go at it in a much more of a coordinated effort. And I'd say that some of the population health investments that we're hoping to make in the prevention aspects that we're hoping to make here in the U.S. is just part of the fabric of healthcare delivery in other countries. On the flip side, as we've seen in some recent reports, recent work that HIMSS has done in Europe and as well as Asia and a little bit in Latin America, the United States has made the investment, particularly on the clinical side, through the HITECH Act, in the 2010 through 2020 timeframe, has created a great foundation to be able to respond. So what we're seeing in places like the EU, they've created a European Recovery and Resilience Fund to help countries begin or improve their digital health transformation, so that they can say that they've got the foundation in place. What we saw in the United States was the investment in the Meaningful Use program, particularly the hospital, clinic, and provider setting. We were able then to layer on top of all that technology, the telehealth services, the remote patient monitoring services that improved access or kept access high, but also kept people safe from being unnecessarily exposed. The same cannot be said in all places around the world. So they're suggesting that they need to make that similar foundational investment.
Yeah, I just wanted to also mention, and you're probably aware of this, Tom, that even in non-OECD countries, like in India, for instance, there's a massive effort underway right now to build this common infrastructure, the National Provider Directory, National Patient Registry, and so on and so forth.
Absolutely.
Massive.
Yeah, Lav
effort.
Agarwal he was the secretariat for the Global Digital Health Partnership, which of course was established about 4 years ago. I think he and the Indian government really have made some great strides, and we're thankful for all the work that they're doing in India, being able to compare and contrast what's happening in other parts of the world. Absolutely.
Yeah. So, this is a massive modernization effort by any definition, and it's going to take place over a very long time. Obviously, there are going to be some implementation challenges. Now, Tom, you pointed out early on, the technology exists. We've come a long way in terms of the foundational technologies, and we've got cloud capabilities, for instance, that have come a long way in the last several years. Now, it's a different story when it comes to the data infrastructure, especially around data sharing. And you and I know this very well. In the private sector, the data sharing is unfinished business. We've come some distance, but it remains unfinished business. What do you see as the big lift when, if the government decides to find the funding for it and then launch the program? What do you think is going to be the big lift from an implementation standpoint?
I think it's twofold, really. Thanks for a great question, because it's the twofold approach. I would say we've gotten the executive order from the president, and which has required Office of the National Coordinator and the CDC to work basically attached at the hip over the last year and a half, and they've selected two great leaders, Nikki Tripathi, of course, who's a longtime HIMSS member and an advocate for interoperability from his days in Massachusetts, and et cetera.
And the current ONC chief.
Correct, the current national coordinator for ONC. Mm-hmm. And then Dan Jernigan, who is no stranger to technology advancement needs of the community, of the broader public health community, but also he has a lot of the experience having worked in HL7 work groups, et cetera. So the first step of making sure that the two agencies are working very closely together, and that they're working in partnership with the public health community. I think it's a dramatic improvement over what we saw in 2020 with respect to the initial response to what seemed to be a lot of fragmented approach. So I think that's the key first step. The second issue that's going to be really a challenge, particularly at the public health, at the state, territorial, local, and tribal levels, so at the stilt levels, is workforce development. You can have an influx of technology capabilities, but if you don't have the data analytics capabilities, whether it's on staff or a hub and spoke approach between the state and the local public health departments, really we need to make sure that that the funding and the workforce are available. So I think that's the second big challenge is going to be the workforce development. So with respect to where it's headed, there's been a lot of conversation at the CDC consortium about what it looks like, what the infrastructure looks like, but just as importantly, getting people to realize that a career in data analytics in healthcare is something worth pursuing. And then just as importantly, data analytics career in the public health setting is just as rewarding. Part of what the administration, what Congress have done over the last year and a half, and I would say that as far back as the tail end of the Trump administration, is beginning to look at those workforce issues. And so the development and release of funding for this new center within CDC on forecasting natural disaster, that is a great new investment that came in with the Biden administration and with Congress's funding. And then secondly, this new omnibus with the DARPA-H, or ARPA-H, excuse me, this modeled on DARPA, the Defense Advanced Research Program Agency. It's this new one for healthcare. I think it's going to have a great impact, not only for the NIH community, which we would anticipate, and which we saw Francis Collins in the tail end of his career, of his tenure at NIH supporting. It also has a lot of great opportunities for the CDC and for the public health community. So maybe a long answer to your question, but I think that's really where we're headed, is the challenges as well as the opportunities.
Well, you talked about the workforce challenges, the workforce enablement. I guess you have to find the workforce, bring them on board,
Right.
and then you enable them. And without making this a political question, how much can the government really staff up on its own, given the scale and scope of what we're trying to accomplish here? And therefore, is there a role for a meaningful public-private partnership of some kind? And what are your thoughts on that?
I think you're absolutely right on, it's another great question. That's why I love this podcast so much. But the twofold really is that it's got to be a public-private partnership. We learned a lot from the meaningful use. I always go back to meaningful use. The historian in me wants to look at the programs and what we learned from those programs in order to make sure the next set of programs works great. And what we've learned is it's got to be a public-private partnership. You've got to, there's an opportunity, whether it's cloud providers who have been right in there and CDC consortium conversations with ONC, and how can we help public health leapfrog into the, use the right technology to leapfrog into the 21st century. It's the systems integrators who have years of experience working with the states and working with the CDC. It's a full, it's got to be a public-private partnership, because the government can't do it by itself. And I guess the other part of meaningful use or the overall high-tech program that we should be taking into this new phase is it's the public health departments don't necessarily know how to they don't necessarily have the expertise to purchase the right equipment or to hire the right staff. So if they can work in partnership with the private sector, whether it's something like similar to the old regional extension center program, or some form of collaboration with the organizations, with the private sector that has that experience, it'll decrease the time to decision making. It'll decrease the cost if you're able to avoid some of the the challenges that unnecessary challenges that could be put in your way.
Yeah, and a related question I have on this is, and I don't know if this was explicitly called out in the report or not. I don't recall it, although I read through the whole report. Uh, what about the information and data security aspects of it? Our current fragmented infrastructure. I've got to believe that that is a concern among other things. How does your report's recommendation address that aspect of it?
So I would say that from a security aspect, if shame on us if it's not highlighted, because what HIMSS has been saying for the last 5 or 6 years is that we've learned a lot of lessons by saying information sharing is key. Provider and patient need access to the just-in-time data, but you need to make sure that it's transmitted in a secure way. HIMSS was big first voice in the healthcare community calling for what is now the 405C and D report components of the Cyber Infrastructure Security Act of 2015. We made sure healthcare was involved. There's now a great collaboration between large organizations and less funded or less resourced organizations on information sharing on cyber. The Health Sector Coordinating Council Cybersecurity Task Force that we helped to really advance is a great example of what the public health community needs to be thinking about with respect to cyber. And just healthcare remains the #1 attacked sector for a lot of reasons. State-sponsored bad actors, just independent bad actors are targeting healthcare. We would be absolutely remiss if we didn't make sure that security was front and center in the discussion. And I'll say that giving credit to our friends at the Council of State and Territorial Epidemiologists, the American Public Health Labs, and the folks at NAPSIS, they, along with the CDC, have been absolutely banging the drums over the last 12 months, making sure that cyber is part of the discussion, is absolutely in the beginning of the framework. So HIMSS and our partners are absolutely believe that cyber has got to be part of this discussion.
Yeah, and I've had one of your colleagues, Lee Kim, on the show talking about the work that you've done, HIMSS has done. So don't feel too bad about it if it's not in your report, because we are, I'm fully aware of the focus on cybersecurity and the work that HIMSS is doing, and so are our listeners. Hopefully, if they've heard the podcast and we talked about the state of cybersecurity, especially now in the context of geopolitical events elsewhere in the world that potentially may impact us. And so, yeah, I think that HIMSS certainly has a focus, and we are very grateful for the work that HIMSS is doing in this regard.
I'll say this, Patty, just before we go off of that, that's if it's not in there, that's a great reason for version 3 of the report to be put out in the next 6 months. Hopefully the number won't continue to rise.
There you go. Well, we have a couple more minutes left here. And so, bringing this all together, Tom, for our listeners and for the audience of this podcast, who are mainly health systems executives and the technology sector executives, mostly from the private sector, what is the big takeaway for them from this report? What should they walk away with when they read your report or they listen to this podcast?
What they should the big takeaway is that it's time for public health to be an equal partner with the clinical setting, and that it's going to take a public-private partnership in order for us to make that investment, the true investment into leveling the playing field between traditional clinical setting and the public health setting. If we've learned anything, we've learned that siloed approach to public health, a reactionary approach, is not going to get us to the kind of success that we're looking for here in the U.S. And that this report really calls on the investment, not only at the federal level, but truly at the state, territorial, local, and tribal levels, so that everyone has the technology, but more importantly, the people that they serve, the health equity is available, and they have equal access to the best available care and the best response times. That's really, I think that's the big takeaway.
That's well said. And thank you so much, Tom, for setting aside the time and talking us through the contents of the report. I strongly recommend this for those listening to the podcast. This report is out there on the HIMSS website, and we'll include a link to it in the podcast as well. So I strongly recommend that the audience takes a look at it. It's called the Public Health Information and Technology Infrastructure Modernization Funding Report. Once again, Tom, thank you so much for joining us on this podcast, and all the very best to you and your team.
Thanks, Patty. Thanks again, and thanks to everyone.